Hi everyone, and thank you for joining. I'm Abhay Singhal, the founder of DeTalks. Today we are going to dive into the DGCA's critical framework for mental health and fatigue management, specifically for flight crew and air traffic controllers. This isn't just about ticking compliance boxes. It's about safeguarding the well-being of our aviation professionals, which is directly tied to the safety of our skies. We'll explore how these guidelines have evolved between 2023 and 2025 and what they mean for you in practice. So, let's begin by understanding the pressing need for this framework. The reality of aviation is that professional skills, while essential, are not enough on their own to manage the intense pressures of the job. Our pilots and air traffic controllers face a constant combination of stress, fatigue, and high mental load that can impact their well-being and performance. This isn't about a lack of skill or resilience. It's about acknowledging a fundamental human reality. The tragic AI-171 crash in June 2025 brought this into sharp focus, serving as a powerful real-world example. In the aftermath, 112 pilots reported sick on a single day, highlighting acute concerns around mental health and trauma. This event was a catalyst, prompting the DGCA to create the comprehensive framework we're discussing today, one that integrates mental health, fatigue, and clinical evaluation to protect everyone involved. Now let's look at who this framework applies to and how it has developed over time. This regulatory framework is comprehensive, applying across the entire aviation ecosystem. It impacts scheduled and non-scheduled operators, flying training organizations, the Airports Authority of India, and even medical examiners. The foundation for these rules is set in the Aircraft Rules of 1937, specifically Rules 39B and 103, which establish mental and physical fitness as a cornerstone of crew licensing and safety management. We can see a clear evolution in its development over the past few years. It began in 2023 with a medical circular that enhanced medical standards for mental health. This was followed in 2024 by the implementation of specific civil aviation requirements for fatigue management. And in 2025, it culminated in the adoption of Comprehensive Fatigue Risk Management Systems, or FRMS guidelines. This shows that it's not a static document, but a living framework that continuously adapts to new information and challenges. So, how does this framework specifically address mental health during routine medical exams? Let's explore that next. When it comes to screening during medical exams, the DGCA's framework emphasizes a non-threatening, conversation-based approach. The goal is to create an environment of trust that encourages open dialogue about wellness, not to conduct an interrogation. The focus isn't on extensive psychiatric evaluations for rare conditions, but rather on identifying common and treatable issues like depression, anxiety, or substance abuse. To facilitate this, examiners use a combination of general cognitive questions, exploring things like memory or decision making, and specific questions related to job performance, such as situational awareness and stress management. These questions aren't for diagnosis on the spot, but to open the door for deeper conversation and, if needed, a referral to a specialist. A key insight here, especially with the 2025 updates, is recognizing fatigue as a significant mental health risk factor. Chronic fatigue can be both a symptom and an accelerator of mental health conditions, making its regular assessment absolutely crucial. This integrated view of health and fatigue leads us directly to our first major mandate: integrated training programs. The first core mandate from the DGCA is the implementation of integrated training programs. On one side, we have the mental health training capsule, which is far more than a generic wellness talk. This training, which must be delivered by clinical psychologists, covers crucial topics tailored for the aviation environment, such as personality development, interpersonal relations, identifying mental health problems, and human factors. Now integrated with this is the new fatigue management training, a key addition from the 2025 guidelines. This is a mandatory minimum 1-hour annual training for all crew members. It focuses on practical skills like fatigue recognition, sleep management, and the importance of self-reporting. The integration of these two is vital because, as we've discussed, fatigue and mental health are deeply interconnected. This leads us from proactive education to proactive support, which is our second mandate. Our second mandate shifts the focus from training to building a proactive and non-punitive support system through the Peer Support Program, or PSP. The entire program is built on a foundation of trust and confidentiality, creating a safe space for crew members to seek help. Key elements include using trained peers and mental health professionals, ensuring the process is proactive and not punitive, and establishing clear, safe pathways for returning to duty. The idea is that crew members are often more comfortable opening up to a peer who truly understands the unique pressures of their job. A significant update in 2025 is the formal integration of post-trauma support into the PSP. This now mandates workshops following any critical incidents and ensures there is a clear process for clinical referrals to help personnel manage trauma. From training and support, we now turn to evaluation with our third mandate. The third mandate establishes a comprehensive psychological assessments framework to ensure evaluation at key career points. This begins with a pre-employment assessment, which uses tools to evaluate cognitive abilities, personality traits using the 5-factor model, and to screen for psychopathology. This assessment is crucial because it establishes a baseline, allowing us to better understand an individual's psychological makeup from the very beginning of their career. Then, when concerns arise, a clinical evaluation is conducted. This involves using specific, validated screening tools to look for conditions like depression, anxiety, suicide risk, and substance use. A major update starting in July 2025 is that all clinical assessments must be conducted exclusively at Indian Air Force boarding centers to ensure standardization and quality. Furthermore, these assessments now formally integrate fatigue-related components, reinforcing the connection between physical rest and mental fitness. So with training, peer support, and assessments covered, how does it all work together as an integrated system? This brings us to the heart of the DGCA's approach, an integrated system where all the components work together. As you can see, it's a continuous cycle of proactive training, ongoing assessment, and accessible peer support. Each element feeds into the next, creating a robust and cohesive safety management system. The 2025 key updates are a perfect illustration of this integration in action. The weekly rest period has been increased to a continuous 48 hours, directly combating cumulative fatigue. Mandatory quarterly fatigue reporting provides the data needed for effective assessment and risk management. The rule for fatigue off now ensures a full 24 hours plus one local night for proper recuperation. And as we've seen, the 1-hour annual fatigue training reinforces knowledge and awareness across all crew members. These aren't just separate rules. They are interconnected safeguards for both physical and mental well-being. Now that we understand the framework, let's look at practical solutions for implementation. Understanding the framework is the first step, but implementation is where the real work begins. To help you navigate these comprehensive requirements, we offer a complete technological solution through 2 platforms, DeTalks and SciPack. DeTalks is designed to handle all your training and peer support mandates. It offers pre-recorded self-paced courses on mental health and fatigue management, which gives your crew the flexibility to complete training around their complex schedules. It also provides the infrastructure for online counseling and your entire peer support program. On the other side, SciPack addresses all the assessment and data requirements. This includes tools for pre-employment personality assessments, standardized clinical screening for conditions like depression and anxiety, and the newly required fatigue-related assessments. Crucially, SciPack automates the compliance documentation, making audits and record-keeping seamless. Together, these platforms provide a streamlined end-to-end solution for DGCA compliance. Please feel free to reach out using the contact details on the screen for implementation support.